It is indeed a pleasure to be with you all this evening. I have missed seeing so many of your faces for the participants that are out there. Do know that we miss you a great deal and we look forward to welcoming you back to PACE. Tonight's call is to give you an update on where we are here at PACE of the Triad and to certainly try to answer any questions that you might have. So let me tell you that on the line is myself, as I said, and I'm Ursula Robinson, the Executive Director. I've been with our PACE program since the beginning. I actually was the first employee hired. Also on the call with me is Dr. Robert Culler. For many of you, Dr. Culler may be your physician, but for tonight's call, Dr. Culler is serving as our medical director because he wears two hats. And then Dr. Culler, by the way, has been with us almost as long as I have. I believe he was the third or fourth employee. Dr. Culler, you'll have to let us know which one you were when you get on the line. Also with me is Nidra Baldwin. Nidra Baldwin is our Director of Outreach and Education, and Nidra has been with us for quite some time as well. This year we're celebrating our 9-year anniversary, and I believe Nidra has been with us at least 8 of those years, if not 9. So we've got a lot of seniority on the phone call. We also have, Nidra's been with us 9 years, excuse me. She corrected me. I've been 10 and she's been 9. Also on the call with us is Adria Smith, who is our Quality, Compliancy, and IT Director. And Adria as well has been with us for quite some time, at least 7 years. So we're happy to have so many senior employees on the line to hopefully be able to answer all of your questions. So I'm going to start us out by just kind of giving you an update of how things have been going so far here at PACE. Most of you, or unless you're new, may recall that we reopened the Adult Day Health Center on July 6th. And we have been welcoming anywhere from 12 to 16 participants per day. That is very different than what we are used to. Before this COVID mess happened, we had on an average 85 to 90 people a day in this building. And so to go from 85 to 90 a day to 12 to 15 or 12 to 16 a day, that's huge. So this building is a little empty without many of our participants here during the day. But certainly it has to be that way until we can get everything settled and the governor lets us open up even more. So we'll talk about that in just a little bit. Those 12 to 16 participants who are here on an average daily basis receive baths or showers. They participate in activities. They have their lunch meal and they have their morning snack and their afternoon snack. Originally, when I first reported on what the staffing was going to look like, I said we would have one staff for every 6 participants, but it has turned out to be one staff member for every 4 participants in the adult day health area. Similar to what I've told you before, we are practicing the 3 W's. We are wearing masks here. We are washing our hands frequently, and we're waiting 6 feet apart from each other. We're conducting those health screening questions, which, by the way, I'm sure most of you are familiar with the new revised screening questions. But for those of you who have not had the chance to answer them, let me quickly tell you what the new questions are. Some are new and some are not. But we're going to be continuing to ask you, have you or a family member that lives with you in the same house been exposed? Have you or a family member that lives in the same house traveled outside of North Carolina in the last 14 days? Have you been in a group setting of 10 or more people that don't reside in your house? Has a healthcare provider or anyone from the health department advised you to quarantine or to get tested? We're also going to be asking you, have you had COVID-19 testing done within the community? In case you don't know, there are quite a few places that are offering that test for free in the community. So we realize we need to start asking our participants if some of them have taken advantage of those opportunities. We're also asking you, do you have a fever of 100 or greater, or feel like you're feverish? Because for some people, just feeling like they're feverish is important for us to know. And then number 7 is a slew of symptoms that we're going to be asking you or have been asking you, do you have? Particularly for the folks that participate in our PACE program, the way COVID impacts you is different than the way COVID will impact children or teenagers or young adults. So it's real important that we ask you a lot more questions about symptoms as opposed to asking the young folks out in the community. So we're asking you, have you experienced any loss of taste or smell? Really be mindful of that symptom. That's very critical, and let someone know if that happens. Do you have a sore throat, a runny nose, a cough? And a lot of this stuff we're learning as we go from the CDC are important symptoms to monitor. Shortness of breath, that's been around a while. Nausea or vomiting, headaches, stomach pain, diarrhea, chills, muscle aches, and any new confusion or inability to be alert like you normally are. Now, if you have some of these symptoms, that does not necessarily mean you have COVID. That just means we need to get on it and we need to figure out what's causing those symptoms. So please, please call us at PACE if you should happen to have any of those symptoms. That's very, very important. We are continuing to sanitize our common surfaces. Our housekeeping person is now here all day, every day, in addition to a team of housekeeping folks that come in the evening after everyone is gone to sanitize as well. We still have limited number of people coming in the clinic as well as on the vans and in therapy. Again, we just cannot afford to have a bunch of people in those areas again, so we're being real mindful of who we have back there. From all I can tell, our telehealth or our visits with you by phone or by computer or a tablet seems to be going well. And that we are doing home visits. Some of you have experienced having an aide or your HCC visit with you in the home. That will continue. Right now, one of the most important things that I'm waiting to hear about is from our governor in terms of whether or not he is going to open up our community or our state a little bit more as a result of the data that he is watching. Now, that doesn't necessarily mean that if he says we're going to go to phase 3, that I am going to open back up to 90 people. Matter of fact, I doubt we'll ever see 90 people here at PACE again, to be honest with you. But we will eventually open up to more people. I just don't know when that's going to be yet. There's just too many things that we need to do. And then finally, I wanted to answer some of your questions that you may have. And first one that I thought about is some of you may have experienced our dental and vision clinic and want to know if we are still doing those services. The dental care is still available, but by emergencies only. And eye care will be provided based on availability. So if you're having those kinds of concerns, please let your doctor know here at PACE. There was a person who asked one time, do I have to wear a face covering when I come to PACE? Will I be required to do so? And the answer is no, but we strongly encourage you to wear face coverings. Although they're not required for those people who can't tolerate it, we understand, but it's very important if you can tolerate it to wear it. And I will say the first couple of days, one of the things that I noticed is that participants were not wearing their face coverings correctly. So in case you don't know, when you're wearing your mask or your face covering, make sure it's over your nose and over your mouth. Okay, lots of times I'm seeing people with it underneath their nose or underneath their chin, that kind of stuff. You want to make sure that your nose and your mouth is covered with your cloth mask. Another interesting question that we had one time was, do I have to come back to the adult day health center when it's safer, when the safer at home phase is listed? And the answer is no. You do not have to start coming back to the adult day health center on a regular basis if you don't want to. We are going to continue our telehealth care, whether it's by phone or by tablet or computer. We also have staff who are going to be visiting in the homes, so it is not a requirement that you come to the day center once the governor opens up or once PACE is fully open. All right, so now I'm going to pause and bring in my esteemed colleague, Dr. Robert Culler, who's going to talk a little bit about what we're doing in terms of medical care. He may also join me in answering some questions that are on our frequently asked list, some of the newer ones. So, Dr. Culler, I will let you take it from here.
Thank you so much, Ursula. She's a wonderful director of our program. So I'm Dr. Robert Kohler, and many of you know me. I was the fourth employee for PACE of the Triad, and I am coming up on 10 years with PACE in December, and it's been a privilege and an honor to be part of this wonderful program. COVID-19, wow, that's quite a curveball has been thrown to us. I think you've heard so much about this, and I will go over briefly the big picture, coming down to this medium picture, down to the picture of where things stand at PACE of the Triad. I want to also reassure everyone on the line that you will have an opportunity to ask questions, probably just in a few minutes, and we will open it up to all those questions that you may have. So if you want to jot them down just to make sure you remember them, we would be glad to answer any questions you may have. So COVID-19, as you probably understand, is a virus that was first originated in China. COVID is actually short for coronavirus. And the reason why it's called 19, it was discovered in December of 2019. So that's why they get that name. Coronavirus is a very common sort of virus, and there's many different strains. But this one was a very different strain that we were not used to, and our human bodies were not used to it, so we were more prone to getting infected and to get sick. This virus is interesting because it can really spread quite easily, and it can spread even in people who do not have symptoms. So that can make it very challenging to try to isolate it and prevent the spread. So it did spread. It spread around the world, and it spread quite rapidly. It seems to be it has a varying degree of severity. As Ursula mentioned, is often not so serious, but it can be serious in children and young adults, but it's definitely more serious in older adults and those with chronic medical problems, especially heart problems or diabetes. So it has come to the United States, and the United States does lead the world in having COVID-19 cases. There could be different reasons for that. But in North Carolina, we have also seen a fair amount of it. Fortunately, I think our governor has done a good job in trying to enforce or trying to encourage the 3 W's, waiting 6 feet apart, wearing a mask, washing your hands, and trying to prevent large groups of people getting together, so that will help reduce the chance of spreading. So we're not as bad as many other states that have suffered through this, but we have suffered. There's been over 1,000 deaths in North Carolina. In Guilford County, we've had 139 deaths so far. And PACE of the Triad is affected as well. We have lost 3 of our participants to COVID-19. It's a real disease. It's out there and it's serious. We've also had probably at least 10 or more who've had the disease and recovered. And interestingly, we have also had people who have had the virus, they had tested positive, and actually never developed any symptoms. So you can see the whole range of disease that this virus can cause. Many of our participants who did get sick had to go to the hospital, but they were treated, supported with oxygen and certain medications, and did well. But it can be challenging for many people. About half of our participants who did get it in the nursing home, and you may have read that in the paper or seen that on television, that nursing homes are a place where a lot of COVID has occurred. Um, the other half have been in the community. They have gotten it for family members or children who visit, that sort of thing. I want to reassure you, though, that none of the participants who have uh, got the virus actually got it from the PACE center or from a PACE staff member. We have been very diligent in trying to make sure that we do all the proper infection control methods that Ursula went over, and we want to be very careful about keeping our participants and our staff as safe as possible. This virus is contagious and quite contagious, and often people have it and don't have symptoms. It is not a fail-safe method. So we're doing the best we can, but it's not going to be perfect. We know that there are some risks with coming in and opening up at the PACE Center, but there are also risks with not opening up the PACE Center. It's been very difficult for a lot of our participants and a lot of our families, so we're trying to find the right balance. Um, in terms of the face mask, it's important to cover up the nose and the mouth because the the face mask is not necessarily to protect the person who's wearing it; it's to protect other people. And it is really a sign of being polite and a sign of being caring about your fellow human being and your friends and other PACE people, other people at PACE. So it's really the polite right thing to do to wear a mask over your nose and your mouth because there are microscopic particles, droplets that are come out of your mouth and nose just with breathing and talking. So I know it can be uncomfortable, but we need people to wear it properly. So we want to do that. Um, and in terms of the incidence of the COVID in our community, we do have data that shows that it started to uh, hit our community just a very little bit in March, increased up in April, and stayed fairly steady, maybe slightly decreasing, but then it bumped up again towards June for sure, and maybe that followed Memorial Day when people were tired of being isolated at home. They got together, and then the virus spread faster at that point. So there was a bump up in June, and the bump continues through July. So it's still significantly higher than it was in April and May when we first experienced this. This virus is not going away. This is going to be with us for a while, and I wish it would go away, but it is not going to. Um, I'm concerned about when school starts as an opportunity for people to get together again, and then that can also cause a surge in virus. And, and but we're going to deal with it. This is part of life, and we're going to uh, be strong, and we're going to make the adjustments that we need to care for everyone. Medical care continues. We're continuing to treat people for their chronic medical problems, for their heart disease, their diabetes, for their blood pressure. We're providing medications. We are available in the clinic to see people as they need to for various for whatever might be ailing a person. We have our staff constantly with our participants to make sure that they're doing well at home. I'm sure you've heard from our social workers and nurses who are checking to make sure you're doing okay. We can do house calls if we need to. We can have people come in and be assessed in the clinic if we need to. So the medical care continues. If we do the screening test to try to identify if anybody may be at higher risk of having COVID, because in that case we want to be extra careful. If there's a suspicion that one of our participants may have COVID, we're going to do special measures to either test them or get them tested. And once they do get tested, we're going to make sure that they get treated properly no matter what the result shows. Um, so I think at that point, I'm going to turn it over back to Ursula, and I think she's just going to ask if there's any questions and open it up. Is that okay, Ursula?
Yes, that's exactly right, Dr. Kohler. Thank you so much for sharing that information. And that's exactly what I'm doing now. We're open up the lines. so that if any of you have any questions, please go ahead and ask. Let me ask you not to say your name or share any personal information about yourself. And the reason why is this call is being recorded and we're going to put it on YouTube. And so we don't want any of your confidential information out there on the internet. So please do not say your name and please don't share any specific information about yourself. But if there are any questions at this time, I'd love to.
Hello?
Hello.
Hello? Yo?
I have a question.
Uh-huh.
I would like to know, uh, wearing a mask at all times. I have real bad sinuses and allergies, and it makes it hard to breathe. So therefore, I know that air without oxygen in it bothers me. Keeping that mask on, I am breathing the same air in and out constantly. Isn't that a problem for most people breathing that way?
That is a great question. I'm going to let Dr. Kohler take that one. Dr. Kohler?
Yes, so much. I'm glad you asked that question. First, wearing a mask, you don't wear the mask all the time in life. Okay, we're going to only wear the mask. We're in situations where we're going close to one another. So in your home, in your car, going for a walk outside, not have to wear the mask. This is when
I can hear what they're saying. It's important that
so it's when we're supposed to get.
I can't hear you very well.
you want me to just kind of go in there and listen to it.
Let me just ask that you mute your phones. If you are not talking, could you please put your phone on mute so we don't have the background noise? It's really hard to hear the person that's asking the question as well as the person answering when we got the background noise. So put your phones on mute if you're not talking. Thank you.
Having questions. Can he start over? Because we couldn't hear hardly anything he said.
Dr. K, would you please start over?
Can you hear me now?
Yes.
Okay. Yes. So that was a very good question about the mask. And the question was, do I need to wear the mask all the time? And would the mask, can the mask actually cause some harm because you're not getting the proper airflow and oxygen? So those are very good questions. The mask is needed when you are around other people, when there's a chance of you unknowingly could spread the virus to someone else. So this would not happen at home. You don't have to wear a mask at home. You don't have to wear a mask if your family members driving you in the car. You don't have to wear a mask when you're outdoors going on a walk or something, or if you're not close to anyone. So you just don't have to wear a mask in those situations. It's only when you're in our situation, if you're in the PACE center, you're indoors, you're around other people. So we don't want to have you share your germs. Also in the PACE van, that's an enclosed area that's very conducive to passing germs that way. So in that case, if we do want you to wear the mask to help prevent your germs from passing and perhaps infecting somebody else without you knowing about it. In terms of the safety about it, I've worn these masks, of course, and they are uncomfortable. They're warm and they're not very comfortable. But they don't cause a health problem. We can exchange oxygen through there. We can breathe in and out. There are some people, though, that do have significant respiratory problems, lung problems, where they already have a problem with their lungs and breathing, where a mask could make it more difficult for them to breathe. So, as Ursula mentioned, it is strongly encouraged. It's the right thing to do. But if there's a health reason why a person cannot wear it, then we're going to respect that, and we're not going to insist if it's going to cause medical harm. But be careful by try to be considerate, and if you can wear it, even though it's uncomfortable, try to do so. If it's making you feel bad, then we don't want you to do so. Just let people know about what you're experiencing. Does that help?
Thank you.
Let's go for another question.
Yes, thank you, Dr. Caller. Are there any other questions?
Yes, I have
I
one.
would like to.
Hello?
Hello.
Okay, looks like we got about 3 people that want to ask
Okay.
questions. So let me let one person go first, and then we'll get the rest of you. Okay.
Yes, I would like to know if how you choose who can come back to PACE and who cannot.
Okay. There is a screening tool that the staff developed, and it's based on a number of factors. It's based on the support in the home. It's based on the participant's ability to function. It's based on whether or not the participant has home care. And the number one reason is whether or not the participant even wants to come back, or if their family even wants them to come back. So we're taking into consideration emotional, psychosocial, and medical reasons to bring the first group of people back to PACE. Now, when the second phase comes for bringing participants back, we will use some of those same questions to call everyone that's not here to see if they qualify to come in during that second phase.
Thank you.
You're welcome. Any other questions?
Have all participants that return been tested?
Okay, I'll answer that.
Okay.
So the recommendations from the CDC, there are set recommendations that we follow to the T. So, for example, if someone had a positive test for COVID or got sick from COVID, we know that there's a certain period of time that we must wait before they are considered not contagious, and that is at least 10 days after tests turn positive, and then the last 3 days must be completely without symptoms. So if the person still has symptoms after 2 weeks, no, they're still considered contagious. But if they recover and they feel perfectly fine, that's great, but we wait at least 72 more hours, 3 more days, before they're considered not contagious. And that's the recommendation from the CDC and the health department, and we follow that completely.
I was concerned about the new people, well, not the new people, but the people who just returned. Were they tested before they came back to the program? Not the ones that you know for sure were sick, but the ones that you don't know is sick.
Okay, so if I'm understanding the question, if Mrs. Smith wants to start coming to the PACE program, if we test her before she starts with the PACE program, even knowing that she hasn't been, is that your question?
Right.
Right, yeah, and that's a great question, and we struggled with that, but the recommendation is not to do that for a number of reasons, um, uh, because practically we can do a test, and suppose on Monday their test is negative, who knows if they caught it on Tuesday or Wednesday, and so it tends not to be practical, and it could be falsely reassuring. Um, so we do not do that. And we had the same question about staff also. Should all staff be checked? If they are tested, then how often do you repeat the test? And the recommendation is not to do that. And we're following the same recommendations as the hospital is and other other businesses. I think the exception is like the NBA and the Major League Baseball. I think they're testing people like every day or something, but that's like a separate situation because they're gathering in unsafe situations, and I think they have to be tested every day.
Another example, Dr. Keller, is the participants in nursing homes. Nursing homes are testing residents on a daily basis in some cases because they're in those close confinements. And they have those same staff members taking care of them over and over again. And of course, here at PACE, one of the things that we are doing is we are keeping 6 feet distancing from our participants and whenever we can from staff, unless they're doing personal care. And if they are, our staff are wearing that protective equipment. And then we're also making sure that they wash their hands very frequently. Did you have a follow-up question?
Are staff been sick since they returned? since y'all open up?
Have we had any staff members who've been sick since we've opened up? We have participants been sick since we returned. Not any participants that've been coming to the Adult Day Health Center. No, ma'am.
Right. Yeah, the participants.
No staff either?
Yes, we have had staff members who've been sick, but not necessarily from COVID. We've had other reasons for staff to be out.
Is there a reason?
Let me also say this, because I think this is important for you all to hear, and then I'll let you finish with your other question.
Okay.
The vast majority of the people that I'm aware of that contracted COVID have contracted it from their family members. That is not only participants, but it's also our staff that had contracted it. And that's because family members are out and about back in the community, working or doing whatever they need to do, and then they're exposing their loved ones. So please keep that in mind to protect your loved ones. Okay. What was the other question?
Why can't PACE test participants, especially maybe the handicapped ones there?
Dr. Cole, you want to take that?
Yeah, we certainly would test.
Because I heard you mention there's free, but you have to take these people out. So is there a way that PACE could do that on premises?
So we do test people on the premises that have symptoms, or that there are situations where they may have to go to a facility or to a healthcare situation where they need to have proof of having had a negative test. So we have tested those people at the PACE Center. We also have people who have symptoms or think they may have exposed, and we will actually check them also in the PACE Center, actually in the parking lot, like they do with a lot of these drive-through testing sites. But if we don't test people just for no reason. They have to have some symptom or some reason that they've been exposed. And if we do test somebody, then we're obliged to say, okay, while we're waiting for the test, we don't know if this is positive or negative, then you have to quarantine until the test results come back. Unfortunately, with all the testing that's being done and the limited ability of labs to do testing, this is often ending up being between 4 and 7 days. So it ends up being that if somebody says, well, I want to be tested routinely, we can say, okay, we'll do the test, but you have to go home for a week. And then a week later, they come back and say, well, I want to be tested again, and it tends not to work so well. It's not perfect. You're right, and we don't know.
I think for me, the biggest thing, Dr. Culler, has been when I heard on the news about if you test someone on Monday and you've got to wait 7 to 10 days to get the results of the test, what if they were negative on Monday when the test came back, but on Tuesday they contracted it? Yeah. And that's the problem with this test. Unless you're doing it like the president has people being tested around him pretty much all the time, 24/7, there's no fail-proof way of detecting it unless you're constantly testing. And so for us, going by what the CDC says, which is test for symptoms, or in some of our participants' case, if they're having a procedure done at the hospital or needing to go to the nursing home for something, that is another reason why they have to be tested. Any more questions?
Yeah, I had a question for the doctor.
Okay.
Okay, if you I notice people will do a temperature check on you first. Can they check your temperature and it be good, and then they'll just say you're okay, or do you think you would have to show a temperature before you get checked?
Yeah, so great question, and you're right. The temperature check is a possible helpful screening method, because if a person has a fever, that person automatically is at higher risk for actually the virus. But you're right, a normal temperature does not rule out having the virus. And in fact, we've had several of our participants who ended up going to the hospital with COVID, And when they had their temperature checked there, they had a normal temperature. So that's a very good point. Having a normal temperature does not mean you're fine. And the screening questions, if you pass all the screening questions and you don't have any of those, you don't answer yes to any of those screening questions, that does not automatically mean that you're fine either. So yeah, this is not
trying to call.
that we have. I'm sorry. Was there a follow-up question?
No, that was fine. That wasn't me. I'm fine with that.
Yeah. So it is certainly not perfect. It's a screening method.
Great. Any more questions for anyone?
I have a question.
Yes, ma'am.
If I keep hearing on television, and you all refer to the face covering should be cloth. Does that mean the little blue masks that you can buy in Walgreens and places, aren't they acceptable too? I don't know why. I keep hearing that, and I keep wondering. I do have one cloth mask, but I have a lot of the others that I've been kind of stocking up on. So I don't know what it means when you say a cloth face covering.
Yeah, I don't understand what. Did you say false? F-A-L-S?
Cloth.
Cloth.
C-L-O-T-H.
Yes.
Cloth.
Cloth. Yeah, It's really just the barrier. So any sort of barrier is what you need.
Okay.
So that's really the point. So cloth is fine.
I think we don't want to know.
Yeah, you want something that's going to block any droplets from coming out. So you wouldn't want,
okay,
a fishnet or something, because that will let the droplets come out. But a cloth will work, and the surgical masks will work, and the N95 masks will work.
Okay. Thank you. I do have my daughter brought me some KN95s.
Okay.
I get her somewhere. I just don't know if they are. I heard that they were almost as good as the N95s, but we're not supposed to get those. We need them for the professionals to have the N95.
And I'm not sure what the difference is between K and N95, but I suspect they're just fine. And we didn't want the public to use all the N95 masks because they were absolutely needed in the hospital. But I think this is catching up now, so it's less of an urgent situation right now.
Thank you.
All right. Any more questions?
Yes, I have a question.
Mm-hmm.
The question is, this person that's supposed to be wearing a mask don't wear the mask, and they cough and sneeze, and you're trying to get away from them. How do one protect themselves from this individual who's coughing and sneezing and throwing up?
Oh, boy.
Yeah.
Whew.
Yeah.
Okay.
And if that's happening in the PACE center, then our staff are going to be instructed to maybe that person should not be coming to the PACE center. And
exactly right.
Or maybe we'll need to isolate them in a separate room, perhaps, because you're right. You can't. Those droplets are coming out. The mask that you're wearing will provide some benefit, but it won't completely block all those droplets. But yeah, that's a risk, and we want to avoid that situation.
And Dr. Culler, I want to add that our staff have been told if there are participants who appear to be sick, who have those symptoms that we talked about, runny nose, coughing, and if folks are not sneezing within their, because some people, because they can't, within their elbows, they are to isolate those folks and separate them from the rest of the participants. Also keep in mind that currently the way we are set up, there's only one participant per table. So we've got more than 6 feet worth of distancing going on in our adult day health center at this time.
I got another question.
Mm-hmm.
Now, as far as the transportation, how are they bringing in the participants? One by one, they wait until they come in, then they go to their designated area, or what? Or how they go about doing that?
Mm-hmm. That's a good question. We have, it depends on the size of the van. Sometimes, most of the time, it's one participant per van. Occasionally, there are two participants per van. And after each drop off, the driver goes somewhere and sanitizes the van before they go to their next appointment. And so they're cleaning the vans after each person is dropped off at the PACE center. Does that answer your question?
Yes. Another question. Yes, it did. Now,
Okay.
as far as bathing, how do
Mhm.
they do about bathing? If someone got to bathe on the same day, or they'll have to change their bathing date, or what? How that goes?
Ideally, we want to have what do you call a protocol for this for to know set days that you're going to bathe, and that's important because ideally we want the same staff members who are helping with your bath doing your bath each time you have it done. In other words, and some people may be a bath every day, and that's fine, but we're going to try to make sure it's that same aide or those same two aides that are doing that bath or assisting with that bath every day that you're needing a bath. So, yes, we prefer to have a set day to have your bath, but if you come in one day and it's not your day to get a bath, but you really need one, you can certainly still get a bath. Absolutely.
Thank you. Now,
You're welcome.
as far as their clothing, how they do about separating their clothes when after they take a bath.
So that's an easy one because we've never washed participants' clothes together. We've always only washed one participant clothing at a time. So after someone has had a bath, their clothes go in the washer by themselves and they go in the dryer by themselves. We don't mix clothing.
Thank you.
Mhm. Any more questions?
Ursula,
Yes.
I have one. When they start back, will we be riding the same people or different drivers?
You could be riding with different drivers and different people. At this point in time, the way things are, we're just not wanting to guarantee anything in terms of drivers or who might be on the van with you. Because we're trying to we're trying to be as efficient as we can, but we're also trying to be as safe as we can. We are still, for the Rockingham County folks, we are still using the Safe Hands. We have used the other company here in town a little bit, not so much. For the most part, we've been able to do our own transports. Again, because we've limited the number of specialist appointments that CJ Medical and Safe Hands have used. We've tried to really limit the number of specialist appointments unless they're urgently needed. So our drivers have been able to take care of, for the most part, all of our transports.
Because I know in the morning I ride with CJ.
Okay. Okay. All right.
So
very good.
Will I still be riding with them in the mornings or?
When you come back to the PACE Center?
Yeah.
I don't know yet. So once they schedule you to come back to the PACE Center, what they're going to do is they're going to look at the routes and see if there's a PACE driver that's going to be in your area. If a PACE driver can incorporate you into his or her drop-off, and if not, then we will rely on CJ.
Okay.
Okay. All right. Any other questions?
I have one question. You mentioned earlier. Sorry. You mentioned earlier that a participant doesn't have to come to PACE. Is there a length of time that they can stay out?
No, ma'am.
Sure that they can keep. There's no length of time.
No, ma'am. So, a lot of people have the false belief that when you are in the PACE program, that means you have to come to the Adult Day Health Center and participate in the activities and the meals. That is not so. You can still have PACE because you're still going to be getting your doctor. If you have home care, you're still going to be getting your home care. We're still going to be paying for your medications, your supplies, your equipment. If you need therapy, you're going to still come here and get your therapy. The only thing that you're not getting is the Adult Day Health Center. and it's not required that you attend the adult day health center. So for those of you who have figured out, this is working at home, and I think I want to keep it like this. When we fully reopen again, you just let us know, and that's perfectly fine. As a matter of fact, before this pandemic broke out, we had participants who were not coming to the PACE Center. And for some who were coming, for some we had them to come only to get what we call the assessment done. So they would come in maybe once a month or once every 3 months or however often that assessment is due and meet with their different team members, eat lunch, and go back home. And we won't see them anymore in the PACE Center until it's time for their assessment again or if they need to come see the doctor. So absolutely, please help me spread the word that it is not required that you come to the PACE Center weekly or whatever that rumor is out there that in order to be in PACE. That is not true.
Thank you.
You're welcome. Any more questions?
Yes, I have a question about the dentist. Scheduling an appointment to see the dentist. Like, how often is the dentist going to be there on site?
Oh boy, I tell you, the dentist we've had to push back to emergencies only during this COVID time. Now, that's not to say in a month or so we might have the dentist come back 2 days out of the month like he used to. But right now, we're only referring people to the dentist for emergencies. And what we will do is, as soon as we figure out when we're going to have him set up like he used to 2 days a week, we will put it in our newsletter. I hope all of you all are getting our newsletter. And if not, I'm going to ask you to call Marilyn at the front desk tomorrow and let her know that you're not getting the newsletter so that we can make sure we figure out what's going on, because that newsletter has lots of good information, especially announcements about what's going on at PACE. And we will certainly put in there when the dentist will start coming back 2 days out of the month. But right now, he is just for an emergency.
Okay, thank you.
Any more questions?
I do have one
great questions, guys. Yes.
Since we no longer can get respite, is there another way to help the caregiver to get respite?
And when you say no longer get respite, you mean at a nursing home, correct?
Right. It's a little dangerous, I think, to send a loved one there right now. So I'm trying
I would agree with that. I'm just sitting here thinking, and you don't want to use the PACE Center for respite during the day, right?
No.
Okay. So not PACE Center and not the nursing home. So one of the things that is happening, which I'm sure none of you all would be surprised about, is that we're having difficulty with some of our home care agencies. And to be quite honest with you, we want to be real careful with home care agencies as well coming into your homes. But that would be the only other option that I could see at this point, is having a home care agency come in for a period of time to allow that caregiver to take a break. And then you are, to be quite honest with you, at that point, you are allowing someone that you don't know into your home.
Right.
That is a fact.
Well, just something to think about.
Yeah.
Put that out there because I hadn't been able to come with anything, and I wasn't sure if you all could think of anything right now.
Yeah.
It's tough.
It is.
Is there a possibility of having like overnight respite?
Here at PACE?
No, at the hardware agency that's on me.
I'm sorry, you broke up on me. Overnight respite, where at?
Oh, at the home.
In the home.
Mm-hmm.
I would suspect that if there was something urgent, that would be definitely something our team would consider. Once again, keep in mind what you're saying is that you're going to allow a stranger into your home. We don't know what the home care agencies use to screen their employees. We know what we use to screen our employees. We ask them to make sure that they're screening their employees, and that includes everything that we've talked about, the temperature checks and the symptoms and the screening questions. But unlike how we can control our staff, we really cannot control what these home care agencies do with their staff, unfortunately.
But okay, but what if it's a possibility that you have someone that you kind of trust that's in an agency to provide that service?
If you have someone that you trust in an agency and we have a contract, that's the most important thing, and we have a contract with that agency and you need respite and the team has approved you for respite in the home, absolutely we can do that.
Okay, that's a good idea.
Mhm.
Thank
Remember
you.
remember those important things though. We got to have a contract with that agency that person works with, and you have to get
And then it
approval
has to
from
be
your
approved.
team.
Yeah.
Yes, ma'am.
Okay.
All right.
But that that sounds good.
Mhm. Mhm. Any other questions? Okay. Well, this is what I'd like to do. If you all would join me, I would like to have a word of prayer as our closing. And for those of you who may not be interested, feel free to hang up. I won't be offended. But during these times, I have found myself really having to call on a higher power to help us get through this time. So if you don't mind, you can either just bow your head or you keep your eyes open, whatever is comfortable for you. But I just would like to offer these words, and it's a prayer for these uncertain times.
Yes.
May we who are merely inconvenienced remember those whose lives are at stake. May we who have no risk factors remember those most vulnerable. May we who have the luxury of working from home remember those who must choose between preserving their health and making their rent. May we who have the flexibility to care for our children when their schools are closed remember those who have no option for childcare. May we who have to cancel our trips remember those who have no safe place to go. May we who are losing our margin money in the stock market remember those who have no money. May we who settle in for a quarantine at home remember those who are homeless. As fear grips our country, let us choose love. And during this time when we may not be able to physically wrap our arms around each other, Lord, let us yet find ways to be the loving embrace of God to our neighbors. Amen.
Amen. Thank you.
And let us love on purpose.
Thank you.
It was good talking to you all, and we'll catch you on the next call. Y'all be safe out there, okay?
Okay, you too. Thank you.
All righty.
You too.
Bye-bye.
We love you.
Love you all.
Thank
Bye.
you.
Love you guys. Bye-bye. Bye-bye.